Psychiatric asylums were part of British culture for over a century. During a time when there was a lack of awareness towards mental health, it's now apparent that the treatment provided was largely experimental and often controversial.
Well, I started working as a student nurse in 1955, I think it was. My first day on the ward was the most frightening experience of my life, because I worked on a ward which was the acute ward, where patients were first admitted when they came in, and a lot of them were very, very disturbed. I walked into all this and I don't think I got much preparation for it.
I was in Barrow Gurney Hospital, Mother and Baby Unit, in 1970. The day after I came home with my baby, I was very tired and confused. I was psychotic, very psychotic, and had to be taken to the mental hospital. I didn't think I was ill until I got inside. I thought, that people were just saying I was ill when I wasn't.
We were in our mid-20s at the time, and I'd never heard of any postnatal depression or anything like that. Or she threatened to kill the baby, and so something had to be done.
Patients' rights were restricted when placed in padded cells. The length of time patients were left in the cell would vary greatly. Some of the patients could be locked away for several days.
The seclusion cells were often made of perspex windows with a mattress on the floor and items removed so the patients could not harm themselves.
I woke up and I was in a warm room, and it was all padded and it was dark. There was no window. Suddenly a cleaner opened the door and I scurried out between her legs because I just wanted to escape. And the poor lady, I think she nearly fainted, so I went back to help her.
ECT stands for electroconvulsive therapy. They would pass an electric current through the brain, and then the person would have what was classed as a fit. I've seen it done where it was done with no anaesthetic whatsoever.
Patients dreaded if they were going to have electric shock. It really frightened them quite a lot.
During the time Brenda was in the Mother and Baby Unit, there was a programme on the television that I was watching that was about ECT, and the nurse stood in front of the television and refused to let me watch it because she didn't want me to see exactly what was going on in the ECT treatment room.
The way in which it was administered was that the patient would be brought into an area where there would be a trolley or a bed, and a doctor would be there, ideally an anaesthetist, and there would be the charge nurse in charge of the ward, and then there would be 3 or 4 other nurses who would be there at the bedside.
They were given like a rubber bone that you would give to a dog, which will absolutely horrify people now, and that was because they went into a convulsion, and it's just like somebody having a fit, and they would grind their teeth, and they were in danger of breaking their teeth, but not alone breaking their teeth, they could break bones. So therefore, as staff, we had to hold on to their shoulders and their hips and their limbs, and occasionally patients did perhaps have a fracture.
I think they wheeled you out of the room. I don't think you walked out. And there was a room, I can remember that now, there was a room with beds, like a hospital ward, and you'd wake up on the bed and you'd feel very tired.
The first thing you would notice is they would say what happened. They would have no recollection whatsoever as to what happened to them.
After I had ECT, there are certain parts of my childhood that I didn't remember, and there's things that my parents used to say to me, "Oh, do you remember when we did this?" And I just honestly didn't.
Now it is a much stricter process because of national policy, protocols and national guidelines.
Like ECT, insulin was another common treatment for schizophrenia. Widely used until the 1950s, doctors would inject large doses of insulin to induce a coma. It was considered one of the first successful treatments for schizophrenia at the time.
Insulin is a complex hormone that is produced by the pancreas. And when there's depletion of glucose, because insulin mops up glucose, then the patient becomes what's known in medical terms as hypoglycemic, which means that blood sugar levels go down to below normal to maintain body homeostasis.
We actually gave patients insulin injections until they eventually went into a coma.
They did get quite a shock by having insulin, and they went into hypoglycemic shock, where they didn't have enough sugar to counteract the insulin.
And then the coma was interrupted by glucose, which we fed through the patients through a nasal tube.
The body is depleted of glucose, which we need for survival. So imagine when you haven't eaten for a day or two, you have a pounding headache, you feel faint. Well, imagine that magnified by 100. That's what someone would feel like when they woke up from an insulin coma. Effectively, what has happened is that the body shuts down and people go into what's known as multi-organ failure.
At times I became a bit disturbed because occasionally a patient would have a fit, and that always bothered me, but then immediately you would interrupt the coma on that.
Although the effects of insulin were sometimes lethal, it was the infamous lobotomy that proved to be even more fatal. Lobotomies were regarded as blind procedures, as the path of the instrument used couldn't be determined. At the age of only 12, Howard Dully was unwillingly given Dr. Freeman's notorious ice pick lobotomy. The case later grew to become one of the most famous of all time, as Dully was diagnosed with schizophrenia despite only showing mild symptoms.
Lobotomy is a transorbital method whereby Walter Freeman in the 1940s and the 1950s used what's known as treponin. They used a leucotome, which is a long steel instrument. They would position the leucotome at the top of the eye socket and use a mallet to break through the skull to reach the frontal lobe. And effectively, by reaching the frontal lobe, they would then destroy the neurons between the frontal lobe and the midbrain, which are responsible for thinking and feeling.
I was in theatre when a couple were performed, and I assisted, but I found it absolutely horrific.
From what I read, I suspect that many patients were not given pain relief during this procedure. Some people died, and there are reports from family members that their relatives who underwent this procedure were rendered into what's known as vegetative states. In other words, they were hardly recognisable anymore. Around 40,000 lobotomies were performed in the United States and around 10,000 in Europe, which included the United Kingdom. But it's likely that the figures were much higher than that.
A lot of patients, by modern diagnosis, were not mentally ill. Asylums were often used as a carpet for the unwanted to be swept under.
There were some occasions when people were in Glenside Hospital who should never have been there.
A lot of people were put in psychiatric hospitals by their relatives, but a lot of the relatives would not want anything to do with the patient.
They didn't want to talk about it, like it was sort of mental illness, so my parents didn't want to talk about it.
Yeah, we were pretty much on our own, weren't we?
Those people who were labelled as homosexual were classed as insane, as well as young women who gave birth to illegitimate children. These people who would then be locked up in an asylum would then experience the negative impact of institutionalisation. Those impacts would then impact upon their mental, physical, emotional and social functioning, which would probably impair them for life.
It is unlikely that these asylums will ever return to society due to the introduction of care in the community, where patients are now able to be treated in their own homes. However, the asylums have left their grand structures and chilling testimonies, which have emotionally scarred those who are a part of the system.
It wasn't brilliant, and at the place I went to work at afterwards, and they asked me what I thought of it, and I said, well, there are some places I wouldn't keep animals in there.
The ECT scared me to death. the disturbed patient scared me. I felt that somehow the staff didn't seem to care about what was going on. I remember a few times feeling like just running away from it all, and it was really, my pride kept me working there.